Just to introduce myself, I am a senior advisor for the Water Sanitation Hygiene Program at UNICEF. I'm Canadian, I'm from Ottawa, and so I can't believe I haven't heard about WASH Canada earlier, and I'm so happy that I'm the season opener, but I do hope to be a participant going forward in these calls. I've been in the WASH sector for about 2 decades now, and I've spent time in sub-Saharan Africa with UNICEF. I've started my career with the World Health Organization in Latin America, and that was actually based on an internship that the Canadian government gave me, and so that's what really sort of propelled my career. But then I spent time with UNICEF in both sub-Saharan Africa and Kenya, working across the continent, but then also in Indonesia as our chief of WASH before taking the role here in New York, where I lead our sanitation and hygiene team. And I have to say that sanitation and hygiene has been something very special to me, just because it's sort of the underdog as I see it in the WASH sector. So really has presented so many interesting opportunities for work and for self-development too, because it takes you on this journey from behavior change to private sector to everything in between. And so it's something I feel very passionate about. But today, what I wanted to talk to you about is this whole issue of strengthening sanitation markets, and specifically based on a partnership that I have been involved with since its very inception in Kenya over 10 years ago. And what makes it unique to UNICEF is that it's what we call a shared value partnership. And that means it's a partnership with another entity where we have found shared value in working together. And so it started in a very organic way, responding to a challenge in the MDG era, but it has evolved over time to really be responsive to current challenges. So the way I'm going to structure this is I want to talk to you a little bit about sanitation access trends, probably stuff that many of you are familiar with, but just to set the stage. I'll then talk about why I think sanitation markets have been failing. I'll talk about the context of why we started this partnership, some of its key moments, and then some key lessons that we've learned in strengthening markets globally, and some recommendations to end off. So just to start with the context, between 2000 and 2024, we've seen huge declines in open defecation, and it means that the world is pretty much on track to end open defecation as per the SDG targets, which is really fantastic. And around the time that we started this partnership, around 2015, we were, in the depths of working with governments across sub-Saharan Africa on elimination of open defecation. And one of the things that was striking during this time is that this decline in open defecation was not being met with a corresponding increase in safely managed sanitation. And so agencies around the world were falling over themselves to try and work on what we were calling sanitation marketing or market-based approaches, looking at how can we meet this newfound demand for sanitation with good products, sustainable service delivery models, and an interest to access these products from consumers. We were also very acutely aware that on-site sanitation was dominating urban and rural areas across both sub-Saharan Africa and Asia. And so, there's a real interest in evolving service delivery models that pertain to on-site sanitation. And by that, I mean households that are connected to a septic tank or a pit, or a fecal sludge management system. So how do we take these systems and make them better than what households we're currently investing in? Final trend, and maybe many of you have seen this, but it's from the glass, and it's basically just a pyramid chart that shows that, of the many, many countries that say they have sanitation policies that are formally approved, when we apply filters to this, we see that there's roughly only around 5% of countries that have formally approved policy with costed plans and sufficient financial and human resources. So this basically tells us that sanitation policies are very much good intentions, but they're not backed by any real meaningful political commitment. So in that context, why do sanitation markets fail? Well, in most settings, these markets operate without consistent rules, enforcement, or consumer protection. So we're seeing, less than half of countries that actually set standards for on-site sanitation design and construction, 14% that collect data on septic tank and pit emptying, and roughly 20% of countries that actually take corrective action for non-compliance. And that leaves consumers vulnerable because it's very difficult to tell the difference between a high quality solution or a low quality solution. And, in a system like that, you're often prone to going for the lowest cost solution. And markets require rules to function. And when there's no lead agency, regulator, or enforceable standards, the market itself becomes fragmented and unpredictable. At the time we started the partnership, we were looking primarily at last mile delivery. And that was an even more risky proposition because we were looking at bulky goods, a dispersed rural demand, weak distribution networks, and high transportation costs across sub-Saharan Africa that made margins really thin. And it was really just way too many expectations that were piled onto entrepreneurs to finance market creation. They couldn't cover the behavior change, the consumer education, the financing, the service infrastructure. Putting that all together was an enormous task. And resultingly, we were seeing programs that were failing repeatedly, and a sector left scratching its head as to why this wasn't working. And the bottom line was that, without some risk sharing in what should be considered a public investment, these markets just don't scale. They fragment and stall. And, really, it's not a level playing field. This is not a normal market that you're playing in. And it's actually quite a scary place for a private sector to make an investment. So why we started this partnership in 2015 was quite interesting. And, it really kind of leveled the playing field for the public sector in a way. It started I think in 2014, I met Jim McHale, who was at that time leading SATO, and he was just starting to pilot SATO pans in Bangladesh. And I asked him why he wasn't coming to sub-Saharan Africa, and he said it was because, one, he wasn't sure of the demand, and whether they would have economies of scale, and they didn't have people in sub-Saharan Africa. And to make a long story short, we agreed finally that I would help him place product in Kenya just to see if there was any interest in the products. And to be honest, I actually didn't think it would work. Because if you look at the products on the screen right now, the stool was one of the products he wanted to test. And, from what I had seen and all the consumer research reports we had done, people were primarily interested in using squat latrines. And I really ate my words, because when I took the designer from SATO into the field with me, people were falling all over themselves for the SATO stool. And I didn't understand it, but it was really coming from pregnant women, children, people with disabilities, old people. Everybody wanted these things. And it just made me realize, these guys, they're professionals. This is what they do. And, the approach that we had had for a long time, working with NGOs, trying to create entrepreneurs out of, small business owners was, it was just, we were outgunned, really. The market failures were so huge that having a player like LIXIL come in and use their R&D lab in New Jersey to 3D print prototypes for us was just really felt like an unfair advantage that I had to an insurmountable problem. So we agreed that we would work together, place product, and for me, it felt like a real step change from this very heavy focus on the public sector, subsidizing product design, business development, market guarantees, which was, approach we were using, to taking more of a backseat, supporting private sector business development through strategic inputs of market and product gaps, and helping them with product placement where they had no footprint in the field. And so that was really the start. And I think, you know, there were a lot of contention with this. There was a lot of contention with this partnership at the beginning. And I don't know if, you know, maybe some of you are thinking like, how could the UN work with a multinational company? And definitely that's what a lot of people at UNICEF were saying to me at the time. How can you do this? Um, and and the answer was, you know, pretty clear at the time. We had done market assessments in so many of the countries in sub-Saharan Africa at that point, and basically they were all coming back saying that there was no market. You know, there was very few products out there that were viable. There were few businesses that were willing to operate in this space. And so, you know, that was the justification that we used to partner with SATO initially. And that, you know, if we were lucky, there would be businesses that wanted to copy them because they would be showing that sanitation could be profitable in rural sub-Saharan Africa. So that was the start of our partnership. Sorry, I'm just trying to get to the next slide. Okay, and so, you know, that was the start of a long relationship that we had with SATO that, you know, is ongoing to today. 2015, we started. We worked in Uganda, Rwanda, and Kenya. In 2019, we formalized the partnership. And at the beginning, it was really a strong focus on rural last mile challenges. 2019, we formalized the partnership and started working in Kenya, Ethiopia, and Tanzania. Phase 2, we added 3 new countries in Asia, and we also started working on system strengthening approach, and it was timed with the introduction of UNICEF's new game plan on safely managed sanitation, which emphasized a system strengthening approach. And then finally to phase 3, where we are now, where we've been working more closely on new challenges like climate and Washington institutions, but also finding it more and more important to make sure that we have a common vision of what success looks like when you're working on market strengthening. And at this time, we had an idea, and you know, throughout we've had this sense that even with a great product, there are several barriers that plague a market, especially where we were working. Low disposable incomes, a fragmented and informal market that don't scale, distribution channels that were sort of inconsistent and scattered, poor road networks, financing constraints, limited access to microfinance, and then a very weak regulatory environment with few standards in place. So the countries we worked across for the duration of the partnership now involve quite a range. And I just wanted to show you this because building on what we were talking about before, we have countries like Ethiopia that have, you know, nearly 80% of the population using unsafe sanitation technologies. We have countries like India, where they're making the most rapid progress in the world right now on safely managed sanitation, but still have quite a sizable chunk of the population to reach. Populations like Indonesia, where you have a huge proportion of the population that has basic access to sanitation, but is looking to move into safely managed. And then you have Kenya, Nigeria, and Tanzania, where over half of the population is still using unsafe sanitation. So phase 1, just quickly to go through some of the key moments here, we were focused on sub-Saharan Africa, and it was really about placing these products, building, you know, a sort of traditional sanitation marketing approach, building supply chains, building a core group of skilled sanitation professionals, piloting of a few financing schemes. Phase 2, there was a recognition that we needed to be doing more to impact on the enabling environment, that there were barriers to market efficiencies that were, you know, being caused by problems in the enabling environment. So we started looking at, okay, we should be looking at a broader spectrum. We should be thinking about the market as something much bigger than simply demand and supply. And we also started working in Asia, which also represented a whole new type of market for us, where we had a saturation. So I mentioned at the beginning that the justification, the green light that I got for working with SATO initially was that there was no private sector in sub-Saharan Africa working on this particular topic. when we got to Asia, it was a completely different game. The market is saturated, and so it became much more difficult to work in a way that was not endorsing the private sector, and so we had to look for ways to create watershed benefits to the sector versus just working to put Sato products into play, if that makes sense. And I will talk about that a little bit more as we get into the examples. But just to say that there were, this variety of contexts, from the low resource, still open defecation, limited sanitation, less public investment in sub-Saharan Africa, to the South Asian context and East Asia Pacific context, where we had more resources, less open defecation, more public finance, more developed supply chains, and it became more about how do you defragment the sector. So it's just to say that the learnings that we had from the study came from this diversity of contexts that we were working across. And that was apparent in phase 2, because we started mapping our interventions, and it became very clear that we were working across a broad spectrum of issues, from policy to financing to innovation to data, capacity building, really trying to figure out what are the levers of the market, where can we have the most impact by intervening. Because we were having numbers, we were actually, after 5 years of the project of the program, there were significant gains in terms of the type of government financing we were able to leverage, the capacity. Over 730,000 people built capacity to deliver sanitation services. We were able to impact on data systems. So there was significant work happening. There were great results as happening through the partnership, but we wanted to understand how to better focus our efforts. And sorry, just to say that in phase 2, that's also when we started looking at the market assessment study. So the study that that produced the 5 lessons, that came about in phase 2 as we started expanding our notion of what a market was and where we could be working. So coming to phase 3, which is the last one, and I just wanted to mention this because it's actually been quite an important part of the partnership and a moment of inflection for the partnership, where we realized that our teams in country that were working together, the Sato teams and the UNICEF teams, had very different concepts of what a market was and what success was. And so for the Sato sales teams, you can imagine that they had one metric, and that was sales. And for the UNICEF teams, it was things like favorable enabling environment, or leveraging government funding to a certain program. And these teams tended to talk past each other in planning, and we realized it was important that we had a common understanding of what we were building, that the sales alone wasn't always a determinant of the strength of a market. And so we came up with this 5-category matrix of what success meant to us. And so I have related data points here, but these are different in the different countries. They've defined what demand creation looks like, what supply chain product availability looks like, what financial support looks like, sales, and the enabling environment. And so this was sort of a watershed moment for us, where we were able to agree on what market strengthening actually meant across the board, and why it was important to the private sector to have favorable environment, enabling environment, why it was important that sales were happening, because ultimately that was the indicator that the market was functioning. And just to say that as we went through the different phases of this program, we also were aware that Sato was evolving new products to meet gaps that were identified from countries. As I mentioned, the Sato TAP came about in COVID-19, during the COVID-19 crisis, when countries were asking UNICEF for low-cost hand-washing stations. And Sato set about evolving this new product that could satisfy that demand, and that was available at a fraction of the cost that countries were purchasing them. But also different products that have evolved over time, and this has been a real strength of the partnership to help evolve products that can meet perceived gaps. And these are all products that are designed for bottom of the pyramid populations. So, jumping now into the 5 key learnings, this is an undertaking that we took to capture some of the learnings between 2018 and 2023, when we were sort of expanding our vision of what the market looked like and trying to understand better where to put our efforts. But just to summarize them, and then I'll give you a few examples from the different countries. But the first one was really looking at, we need to think beyond supply and demand of toilets, and really understanding that initiatives need to address things like consumer and enterprise finance, policies and regulation are really key parts of a healthy functioning market. And without working on these areas, it's very difficult. It puts a lot of stress on the basic model of supply and demand. So, looking at, what are those things that need to be supported to arrive at a healthy functioning market. The second was around public-private promotion of toilets as a smart way to co-invest in creating demand. So it's about piggybacking government programs and platforms that are ongoing, that are either directly working on sanitation or have the promise to support sanitation, but looking at, sanitation not just as a private business, but really it's also that sort of convergence between the public health good and the private interests need to converge in, especially when we're talking about last mile communities. Third was around market fragmentation. And when we talk about this, there's so many different ways that this can be overcome, and it needs to be contextual, and it needs to be thought of considering the different market system that you're looking at, how saturated it is with suppliers, and I'll talk about 2 different approaches that we have taken in the program to address fragmentation. Public finance can expand and sustain access to privately supplied toilets, and so a lot of times when we talk about finance, we're talking about commercial finance, and this program really showed that the first stop was looking at government public expenditure and how do we influence these public funds to be diverted into strategic, meaningful investments that can leverage greater access to sanitation. And then finally, addressing and identifying the rules that can lead to better functioning sanitation markets. So this was really about diagnosing, what rules, laws, standards enable, block, or sustain changes in the market. And so we across the board have been working to identify these and to try and streamline our efforts in these areas. So let me just go through a couple of examples from the countries. So, the first lesson was about working on a market-driven supply chain isn't enough. And, our approach, as I showed, evolved from, a simple demand and supply approach to a more multifaceted approach. And I think the Kenya last mile business model is a good example of this. It was also the very first country that we worked in. But in Kenya, we were truly looking at last mile communities, and we realized, and also we were very lucky because in Kenya, there's a very strong CLTS program led by the government. And they were also seeing the same trends in increased demand, but a poor service provider and products availability in some of these areas. So they were very excited to meet the SATO team. They're very excited about the products that we had. And so we agreed that community health promoters that were already active in these areas should become part of the last mile agents for the program. They should be helping to sell these products to communities. And in this way, UNICEF was also able to support the government to push for a bylaw that meant that these community health promoters, who were actually volunteers, would get a stipend for this business. So it was really a merging of that sort of, public health role and the private interests coming together. At the same time, we realized that the community health promoters had bigger ambitions and they wanted to make this a sustainable business. And so they were looking to actually expand their offerings from just latrine slabs to things like agricultural products, seeds, and hygiene products. And so they were looking for credit, financial credit. We started working with Finish Mondial, who started helping them to become more credit worthy. So they were looking at training them to develop their credit worthiness, their record keeping, so that they could leverage greater finance from commercial finance. And so it's been a very interesting model with different players involved. And of course, LIXIL was strengthening the supply chain to ensure that distribution channels, market activations, retail engagement were happening. So all this is sort of happening in tandem to make sure that the last mile distributors are viable, sustained, and that, and we're working with the government as well. So it was sort of a tri-party, actually four-party partnership in Kenya. So complex, but it certainly is a deviation from the straight market, supply and demand approach, where we had different actors helping strengthen different parts of this chain. The second lesson was around public-private promotion, and we were talking about, how do we blend that public health and private sales incentives? Well, we just heard from Kenya was a great example of this, but looking to Asia, we saw in in India, the fantastic work that was happening under the SDM. Sorry, my dog has just yanked my power cord. Anyway. In India, we have the fabulous retrofitting campaign that happened, and that's ongoing under the SBM2 program. And this is essentially, huge amounts of public expenditure going into information, behavior change, convincing households and communities to invest in upgrading of their latrines to a twin pit system that would be safely managed. Within this context, UNICEF and LIXIL have been working to support this work. Information, we've expanded it to new states, and we've also been helping to identify gaps in products. And so there's a specific fixture that connects the twin pits that allows for an easier upgrade of existing toilets to the twin pit system that LIXIL has been able to place in these platforms, while also supporting the greater efforts of supporting communications and outreach to communities. A third lesson is around reducing market fragmentation across contexts. And as I said, we were working in sub-Saharan Africa, where we had a lot of the traditional market fragmentation associated with last mile service delivery, long distances, communities spread out across different places, different supply chain actors located in different places, not really offering a complete toilet solution. And so in that context, the options were around, the community health promoters, working with local authorities, like in India to working with local authorities like we were doing in Tanzania to support, piggybacking of government programs to offer some of these solutions, and then organizing sanitation businesses. So one of the interesting models in Nigeria has been where UNICEF and LIXIL have been helping toilet business owners to connect with each other and to offer a full value solution to sanitation construction. Previously, they were sort of working independently, but we're trying to organize them and have them sort of leverage each other to be able to offer more complete solutions. So that's one, nature of the way we've helped with market fragmentation, is sort of organizing the different toilet business owners in Nigeria, versus in the green here is the two approaches that we're seeing in India and in Indonesia. So India also has a type of one-stop shop, which is run through these women's help groups. And so they offer a lot of the products, they offer a lot of the information to rural communities and urban communities. In Indonesia, they're hoping to do the same kind of approach for one-stop platform, but online. And so it's almost a type of Uber, but for pit emptying and septic tank construction. And so I'm very excited about this. I'm hoping it will come through for any of you who have been to Indonesia and are familiar with Tokopedia or Gojek. They have all these great apps that can, you can order someone to come and fix your tire, on the side of the road, and they magically appear on the back of a motorcycle. Well, the idea is something similar, that you would use this app and you could get this sort of complete solution to converge on your house, and be upfront in terms of the costs, and connected to different funding sources. So, there are different approaches to fragmentation of the sector that are being taken across regions, and also reflecting what makes sense in different contexts. Lesson 4 is around smarter public funding that can be used to sustain access to safe sanitation, stimulate markets and private investments. So it's how do we use this more strategically? What we found in our program has been 3 models. There are, I'm sure, many more, but these are the ones that have been very effective for us so far. In Ethiopia, we have a social protection scheme that is essentially targeted at bottom of the pyramid populations, and there are rules governing what the funding could be spent on. But now sanitation is one of the areas that this funding can be spent on, and so it's kind of a public subsidy program, or conditional transfer program, but it now includes sanitation as a result of this program and the advocacy that we've had. In Nigeria and India, we've also been very successful in influencing government lines of credit to support upgrading of toilets from basic latrines to safely managed sanitation, essentially to the twin pit latrine. And then Model 3 has been around helping or leveraging the promotion, the budget for government promotion, community health promotion, and behavior change to support increased sanitation access. And that was the example from Kenya, where the government started providing stipends to community health promoters to support last mile delivery of sanitation solutions. And so an example that I wanted to share on this was in Nigeria. State governments and UNICEF have been supporting the foundations for a revolving funds model to support households in upgrading of latrines. And this is being run through toilet business owners, who become the sort of last mile agents, who are offering both solutions and a finance mechanism at low interest rates. And this has come to be a very good example of how public funding can be channeled effectively to support upgrading to safer and sustained models of sanitation. So finally, lesson 5 is around a more nuanced understanding of policy enablers or blockers is key to creating a stable and well-functioning market. So, in various instances, we were supporting an enabler, a new strategy or guideline. We had an FSM strategy in India that we supported, for example, that was very useful in helping to advocate for greater funding going into this FSM program. For example, also in Kenya for the community health promoters, that was also a bylaw that we successfully advocated for. Removing a policy blocker is another area, and we had that experience from Ethiopia, and I'll share that in a moment. And then sustaining, again, seeing government pilots that are working and supporting the scale up. And to date, we've been able to identify these via stakeholder consultation, market assessments, but this has been really important to help us really focus and leverage limited funding and time and resources into the right part of the market that needs support to function more effectively. So for Ethiopia, for example, we knew that high import taxes and foreign currency restrictions were having a major disruption on supply chains and limiting affordable sanitation hardware coming into the country. And so we have been working actively with the country government to develop a new finance and sanitation strategy that advocates for a reduction in these taxes. From what I last heard, this is very likely to go through, but will have a huge impact on the effectiveness and efficiencies of the Ethiopian sanitation market. So maybe just to summarize some of these and really sort of future looking, as we think about market-based sanitation, we do need to consider the broader context, that this is not just a consumer and supplier model, but there is something much broader at play when we talk about sanitation because of the underlying issues of the sector that needs a lot of reform. So how do you level the playing field, taking into account? And you really do need to think about those as you go in. To consider a different PPP, the public-private promotion, leveraging ongoing government programs that support sanitation, especially when we're talking about last mile. And these are some of the major platforms and channels to communicating with dispersed populations. Addressing market fragmentation across the value chain is super important, and it looks different in different contexts and really needs to be a contextual approach to address what is happening. And so I think this whole issue of diagnostics and diagnosing the market, understanding what's wrong, and then setting to work to address this. And I think part of the power of this Make a Splash partnership is that we're seeing both sides. So UNICEF has been working on the public sector side, looking at government, looking at the enabling environment. SATO has been looking really at, supply chain issues, the demand creation issues, and sort of feeding that to us. So working in tandem, we're trying to correct some of the market failure issues, to focus public finance and funding to support the market. And then finally, identifying policy rules that enable block or sustain and focusing on those to support greater efficiencies. So obviously, all this work is happening in a much greater context of UNICEF programs, and it's benefited from those, and it's also benefiting our other programs. But I just wanted to mention a few of them that you can also download and have a look at. There's our game plan to reach safely managed sanitation, which came out in 2022, but it's already had an uptake of, after the first year it was launched, the first 2 years, our baseline study showed that we have increased uptake of safely managed sanitation programming by over 25% in a short time. So it's a good sign that countries are moving in this direction. Our second resource is the study from which a lot of the insights for this talk came, the Make a Splash 5-year lessons learned from strengthening markets for sanitation. So I encourage you to have a look at that. And then finally, the issue of on-site regulation is very important to the future of safely managed sanitation. And we undertook a study with SOS looking at pioneering countries in this area. So countries like Kenya and Zambia that have undertaken to expand the mandate of the regulator into rural areas and looking specifically at on-site sanitation. So this document documents the journeys of these the 6, or I think it might be 5 or 6 countries that we looked at. And so I think it's actually a very interesting read into how they undertook that exercise. And I think I will end on that note, and I look forward to hearing your questions and comments. Back to you, Taylor and Caetano and Kelsey.